patients with spina bifida do sometimes need bladder surgeries, and it really depends on what the problem is that we're trying to solve. Some examples are, if a patient has difficulty emptying their bladder, they may need to catheterize their bladders several times per day to empty their bladders. If a patient has difficulty doing that through their urethra, then sometimes we can create a channel through which they can catheterize more easily. This is something that's called the Mitrofanoff procedure. Basically, we borrow the appendix, which nobody really needs, and we create a channel that's connected to the bladder, and the other end up to the belly button typically is where we put it, and then the patient and family can catheterize through that rather than having to catheterize through the urethra. Another example are patients that have leaking of urine. So the bladder looks like a hot air balloon and it comes down. It's supposed to taper down so there's tone at the bladder neck, which keeps us dry. It enables us to hold urine. So if that tone is loose, some patients need tightening of that area. And we can do that in a variety of ways, either using a device called an artificial urinary sphincter, or placing a sling around the bladder neck, or even reconstructing the bladder neck to make it more narrow. Lastly, some patients whose bladders are really diseased and not responding to medication, we have to make the bladder bigger, and that procedure is called a bladder augmentation. In those procedures, we borrow a patch of intestine and then open the bladder and then put that patch of intestine on top of the bladder. And that physically increases the size of the bladder, allowing patients to hold a lot more urine at very low and safe pressures. Sometimes patients get all three of those procedures. Sometimes they only get one or two. Again, it really depends on the problems that we're trying to solve on a case-by-case basis.